The following is the update, which with the latest coming in just literally a half an hour ago, as it relates to the number of tests that have resulted in additional COVID-19 cases. So the number of confirmed COVID-19 cases has risen to 252, and that's based on 19 new cases that have been received in the last 24 hours. There are now 131 confirmed COVID-19 cases related to that particular workplace cluster. Their ages range from 18 to 52 years, including 104 females and 27 males. They are primarily from the parishes of St. Catherine and Kingston and St. Andrew. In terms of the case classifications, there are now 34 imported cases, 53 contacts of a confirmed case, 8 that are local transmission with no epidemiological link, and 148 that are under investigation. Of that 148, as said earlier, 131 have been identified within a workplace cluster. In terms of testing, yesterday we commissioned the Cobas 6800 machine. Training of staff has also been completed, and the facility is now able to complement the work done at the National Influenza Center with the capacity to test approximately 380 samples per 8-hour shift. And if we do 2 shifts, then it's double that. We do have the capacity to do 3, which would take us over 1,000 for that particular machine. And this is a major development for us because it means it has significantly expanded our capacity to test. The real challenge now is to ensure that we get the samples to be tested. And that involves a different set of variables, which we have worked on, are working on, with the latest addition being, of course, the 5 mobile units that were added and deployed last week. So far, 2,125 samples have been tested. 252 are positive, 1,872 are negative, and there's 1 pending. We expect to test quite a number of samples over the next 24 hours. We can elaborate more on that later on, but given the new addition, which has now demonstrated its capacity to function accurately, we should see quite a few hundred of samples being tested over the next 24 hours, which could or may adjust the numbers in terms of positive tests. There are 230 persons in terms of isolation, 71 in quarantine in a government facility, 814 in home quarantine in St. Catherine related to a workplace cluster, 31 in home quarantine in Portland, and this is based on contacts of confirmed cases, and 28 persons have recovered to date. 6 persons, unfortunately, have tragically passed or died. So we are making contacts in our progress in terms of recovery, 28 persons, and as you would imagine, the number of persons in isolation and quarantine have grown substantially for a number of reasons, and I really want to just salute and recognize the efforts of our medical team, including those in the field doing the contact tracing, those managing the quarantining and isolation facilities. That burden, that part of the challenge is getting significantly more stressful, more engaging, requiring a lot more attention. In terms of contact tracing, the health department across the island are currently tracing approximately 1,409 close contacts of confirmed cases. So in addition to the hundreds that are in quarantine or isolation, whether home or institutions, the team are in the field every day seeking to identify and to follow up with and to interrogate and to test and to collect samples of some 1,409 Jamaicans. And that number is a moving target. It increases each hour, depending on the information and depending on the next confirmed case. And again, I think it's important that the public appreciates and understands that because their input, their participation is so important. In terms of the Ministry of Health and Wellness, you would have heard that a number of our staff members have confirmed positive over the last few days. I believe it is 7 individuals. Sanitization exercise has been completed in all buildings that, having done the investigations, are identified with these individuals who have tested positive. Counseling for staff members has begun and will continue as necessary. Contact tracing at the head office has commenced, and some members of staff have been appropriately notified. Some have been placed in home quarantine and given additional information and follow-up action based on their role and based on the contacts that they have come in touch with that may be affected. Today, over 100 additional samples were collected from staff members, and this sampling exercise will continue into tomorrow. So we're doing a lot of testing also of the Ministry of Health personnel, even where we feel the risk is minimal. We're not taking any chances because we want them to be given the reassurance in the first instance, but certainly also to the extent that we need to contain any possibility of spread. It is important that we do so again, because these are the operatives in the field. We need them, and we have to give them full and maximum support. We are in the process of developing a circulating to our key stakeholders a staff welfare protocol that speaks to the care of team members, including those on the front line who may be vulnerable to COVID-19. We have made a few adjustments to enhance the approach to ensuring that the frontline staff, members in the field, those who are coordinating the activities, are adequately given the support and the protection that they deserve and that they need. It is so important that the public recognizes that they have a critical role to play and that they follow the guidelines that are outlined. So the staying at home, avoiding crowds, the frequency of washing and sanitizing hands, the wearing of masks in public, all of these are so critical as we seek to manage and overcome this critical, very important public health threat that we face. We're also encouraged, of course, to cover your mouths and noses if sick or when in public, and that, of course, represents the wearing of masks.
The Universal Service Fund has joined the national fight against the COVID-19 pandemic by providing Jamaican $17.5 million in information and communication technology support to the Ministry of Health and Wellness. As you are aware, the agency, Universal Service Fund, falls within the portfolio of the Ministry of Science, Energy and Technology. It has upgraded the bandwidth speeds of 59 health facilities across the country. The beneficiaries include health departments and centers, regional offices, and hospitals. The upgraded connectivity is to facilitate an uptick in demand for connectivity by the Ministry of Health, particularly through video conferencing, data transfer, and archiving activities during the national response to the coronavirus. The additional bandwidth will also enable healthcare providers to engage in telemedicine, teletriage, and virtual clinics. The provision of the additional bandwidth is in keeping with the ministry's mandate through its departments and agencies to leverage internet connectivity for the public good. Fighting this pandemic, as we all know, will require all hands on deck. Now more than ever, we have seen the power of internet connectivity in keeping stakeholders informed, facilitating communication among colleagues, and enabling research. With this increased connectivity, the Ministry of Health and Wellness will be better able to fight the pandemic. The arrangement for increased bandwidth has been made for 7 months, with an assessment of the service to be made after the 4th month to determine if additional service is still required.
On behalf of the Ministry of Health and Wellness, really want to say a big thank you to the joint-up approach to this COVID fight. These resources will be very useful because, as you know, this fight is a national one and we have to reach right across the country. So the bandwidth and greater reach and data transmission is absolutely critical.